Okay.
There's
Could I ask a second question?
Sure.
Is there any organized effort that is succeeding in trying to change this ludicrous?
Yes.
There is?
There's several, and if you go into the National Vaccine Information Center, that's the organization. It's actually based out of Vienna, Virginia. It was started there anyway, by Barbara Lowe Fisher, and she's the one who created the Vaccine Adverse Events Reaction System. And on her website, there are tons of resources and groups that are fighting to get what I think that we should have, which we were going to lead up to right now anyways, informed consent. You know, the problem is when they give you your child a shot, they don't give you informed consent. They go in, you get the shot, you leave. They don't tell you all of the risks associated with that. And by law, that should be done.
Yes.
And so that's the biggest thing. If you want to give your kid this after reading everything about it, then go for it. But most people don't have that information, and they're blindly going on faith that this is safe, and it's not. So, her website has a ton of information, so I would check it out and find out your state requirements.
Mason, go into Google search and go into mandate inoculations in Maryland, and you're going to come up with tons of stuff, including how to circumvent all of this nonsense in your state. There's pages and pages of articles on it, and I think in there you're going to find articles as recent as 2009, which is what I was alluding to earlier on the mandatory vaccinations and the penalties and actually the things that they were going to do to take children from their parents and forcefully inoculate them. So, you know, there's also a video on YouTube by Ron Paul about mandatory inoculations that you may want to check out. So do your homework, and I think you're going to find some things. If we can help you, if Dr. Jen can help you, go to Roselle care.com. That's ROSELLECARE.com. Drop us a note, and we'll get back to you with more information.
Thank you for the information, and thank you for the good work you're doing.
You're welcome, and thank you very much. 888-630-9625, 888-630-WMAL. Love to talk to you on any subject. My guest in studio, Dr. Jennifer Sims, our pediatric specialist in our practice, but also someone who is focused and specializes in the area of interest of immunizations and inoculations, and she's going to be doing in-house continuing education program this Wednesday evening, the 9th of the month, 7:30 p.m. Join her if you'd like to know more about it, if you'd like to ask her questions, if you'd like to find out if, in fact, these things are affecting you in any way. 703-698-7117. Call our office. Tell my staff that you'd like to attend. You need to register. It's a gift to you. It's a courtesy presentation, but we need to have a reservation, so give us a call. Dr. Jen, let's talk about informed consent.
Yeah, let's talk about that. That's my, and that goes across the board for pretty much everything. People are not getting the opportunity to get information. And when you take especially a new parent who doesn't even know what to do with this new baby when they bring them home, and actually before they even get them home, they're given hepatitis B shots because, you know, all newborn babies are IV drug users or prostitutes.
That's right.
Yeah.
They've been out there messing around in womb.
It's ridiculous. So these parents don't get the opportunity to even get educated. They just go with the flow, and they don't have all of the facts. Like, I think most logically thinking parents would say, you know what? I don't have an IV drug use problem, and last time I checked, I wasn't a prostitute. So I think the statistical risk of my child getting hepatitis B is pretty low. Maybe I don't want to do that one, you know? And the thing is, you have options, because just knowing that little bit of information, you can sign waivers in the hospital saying you don't want those shots. I've had 2 hospital births, and neither of my children have had those shots because I was educated enough to know that I didn't want to do that. And there are forms and legal things put in place for people who are educated. But it's assumed that the masses aren't, so let's not educate them.
No, we don't want them to do that.
We don't want them to be smart.
That's right. They may say no, and guess what? We may not sell as many drugs.
Right.
And, God,
so
wouldn't that be a horrible thing?
Informed consent is paramount. It's essential, and it's something that we have a right to know. And like I said, Barbara Fisher on her website really goes into that, the movement with it. There's petitions. There's a whole lot of things that are going on that she's spearheading with a lot of other doctors and people that are realizing that we need to make changes, and this is a big one. And I tell my patients, you know what, once you have taken the time to explore the subject and you still feel, knowing everything that you've read, both sides, that you want to vaccinate, then go for it. But at least do it with some education behind you. You know, people take more time purchasing a vehicle, seeing which car they want, with the interior, the color, you know, the make, the model. They spend all this time purchasing a car, and yet they have this child, and they fill it up with, they just blindly do things, give them shots, don't feed them the best. They don't take the time to research what they're giving their children. And it's, honestly, it's not okay. There's no excuse for it. The information that we have immediately ready to us at our fingertips with the internet now, really there's not that lack of information. We as parents, and not even just parents, we as people really need to take the time to just ask questions.
They have to ask the questions. You know, the interesting thing is that the American Medical Association defines informed consent, and I'm quoting, a process of communication between a patient and a physician that results in the patient's authorization or agreement to undergo specific medical intervention. The principle behind this process reflects respect for patient autonomy, and in particular relevant to the administration of vaccines. The Declaration of the Helsinki, the highly regarded international guidelines for research on human subjects, states that consideration related to well-being of human subjects should take precedent over the interests of science and society. Well, that may be well stated, but unfortunately in application, that's not what we're seeing.
No.
And it manipulates it to the point where they make you think you have absolutely no control. The fact is you do have control.
Not only do they make you think you have no control, they use a beautiful thing that's worked for centuries and centuries, which is guilt. You know what? You're a bad mom. You're a bad dad. If you don't do this, you're putting your child at risk. You're putting other children at risk. What you're doing is wrong. And so parents, you know, they don't know. They don't know. They don't know enough to ask the questions, and they do it out of fear. And that is the worst reason to do anything. And unfortunately, that's a really great tactic, guilt and fear. And that's another pet peeve of mine, that, you know, the whole thing on, if you don't vaccinate your child, you're now going to expose the population, and you're selfish, and you're going to spread the disease. And they say that they're basing it on the studies on herd immunity. And if I could swear, I would on national radio here. You know, herd immunity was done on non-vaccinated populations.
Yeah.
Okay, can I say that again?
Go right ahead.
Was done on non-vaccinated populations. Non-vaccinated people provided herd immunity to the people who were. But the studies have been twisted, the terminology has been tweaked, and so they're not even applying the right principle.
Well, what happens
when they say this, and it's just so infuriating, because it's like, did you read the studies?
Well, what happens also is things get into process in any practice, in a physician's practice, and it becomes a routine procedure, considered routine. And most physicians don't even understand the process underlying what they're doing. They just don't get it. And subsequently, so this dialogue, this discussion that is encouraged between patient and physician becomes truncated, if not entirely omitted. In many situations, they don't tell you. They don't give you the end piece of what could take place. So it's a situation where you're not getting what you need to get, and it's not being presented in the platform of, listen, these are your side effects. These are the things that potentially could happen. This is what happens, that your child has a potential for autism, that if you put mercury in the body, you're going to scramble the brain. There's so many different things that you need to know about. And as we've said many times, don't believe us. Go do your homework. Yeah. It's there. All that stuff's out there. Go into a place called vaccineethics.org and check that out. And I think you're going to find a whole lot of information that your physician isn't telling you about and that you need to know more about. My guest in studio, Dr. Jennifer Sims, and we're talking about vaccines, vaccinations, immunizations, and she's going to be talking about that this Wednesday evening, the 9th of the month, in our office at 7:30. If you'd like to attend her lecture, 703-698-7117. We'll be right back. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. My guest in studio, Dr. Jennifer Sims, who's going to be your host this Wednesday evening, the 9th of the month, and she's going to be talking about vaccinations, questions you need to ask about yourself, and any potential that you have down the road. Thermography Centers of Fairfax, ongoing sponsor of Dr. Tom Roselle Live, would like to let you know, ladies particularly, that did you know that thermographic imaging can show up breast cancer 5 to 8 years before it actually can be detected on mammographic examination? The month of February, and in conjunction with Have a Heart, Thermography Centers of Fairfax would like to offer you a special. Normal breast scan is $225. For the month of February only, they will offer it to you at $198. Give Dareth Painter a call at 703-943-7248. That's 703-943-7248. Dr. Jen, let's go to the phones. We have somebody else waiting. Joan from Lorton, how can we help you?
Good morning, Dr. Roselle and Dr. Sims. As an adult or even a child who's had vaccines in the past, what can we do to lessen or kill the impacts of these vaccines?
Joan, what we're going to do is we're going to close you off, and then we're going to talk about it because we have a couple minutes, and we'll try to answer your questions as completely as we can.
Okay.
Dr. Jen.
Yeah, there's a lot you can do. Everything goes back to strengthening the immune system. We can start increasing our megadosing with vitamin C. Helps. Vitamin D is essential. Cleaning up the diet, getting rid of anything that's processed, anything that's going to depress immune function, decrease white blood cell count. So that's the things that you're always talking about: sugars, coffees, sodas, whatever.
Yes, sugar, sodas, coffee, fast foods, fried foods, alcohol. Yes, I got to teach you.
All those things decrease immune function, so you want to make sure that you or your child is getting good, adequate, very good nutrition. You can. There's some antioxidants that you can take. Like I said, vitamin D is really important. Vitamin C, Dr. Roselle. I mean, there's a million different things we can do. There's
chlorella. There's chelating agents such as EDTA if you want to use them, but even Captomer.
Which is succinic acid, which helps pull heavy metals out. If you indeed had a, if you're older, we've all had mercury in our system.
Yeah.
So
the MSA is within the product, and you can dump this of ionization detoxification, which we use in the office, low energy light laser. There's homeopathic guidelines that can be utilized. The list goes on. You have to take each person individually, and you also, when you detox metals or any of these poisons, you have to make sure that the intestinal tract is working the way it's supposed to, because what happens is that once you dump the stuff out of the tissue and through the lymphatic system, it gets into the gut. If you have what we call a permeable gut, meaning that the tissue is swollen, it's irritated, it's cracked, it's fissured, it's not digesting things properly, you back it up into the system and dump it back into the liver, and now you're sick all over again. So we have to be very, very careful, but there's a tremendous amount of things that can be done. Dr. Jennifer Sims is going to be your host this Wednesday evening, and she's going to be talking about vaccinations very intimately, very specifically. If you'd like to know more about what's happened to you, what potentially can happen to you or your children or your grandchildren, this is a night I would encourage you to attend, because this doctor has all the information, and she'll sit there and offer it all up to you. Give our office a call. It's 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Jennifer's presentation. Dr. Jen, 20 seconds. How would you like to say goodbye and wrap it up?
Get informed. Take the time. Do the research. Ignorance isn't an excuse, and that's my main point. You can, as long as you have done your homework, you can make a choice.
I could keep this woman on forever and ever, but we can't. We gotta go. We'll see you next week. This is Dr. Tom Roselle. Bye.
Bye.